Hi everyone, and welcome to Unit 13, Module 70 and 71. This is your Intro to Therapy module. We're going to talk about a bunch of different perspectives in therapy today. Here are your learning objectives, and here's your vocab. So, there has been a long history of treatment for those suffering from mental illness, from holes in one's skull, to bleeding, to beating the devil out of someone, also just like sunshine and warm baths and things like that. And obviously not all of those things were helpful, and in some cases, in many cases, they were harmful. So there were a series of reformers, including Dorothea Dix and Felipe Pinel, who worked to push for reforms to treat those suffering from mental illness more humanely, specifically creating facilities that were more humane. And while this was showing improvement in the 1950s, they did start to develop drug treatments and community-based treatment programs, which actually meant that less people needed a facility and were able to exist in society and not in a facility for long term, which is great. So psychotherapy is just that umbrella term for therapy. It's an interaction between an individual seeking help or growth and a trained therapist. There's also biomedical therapy, where someone might receive medications or other biomedical treatments that we'll get into to help them physically feel better for their mental health. And lastly, there's something called eclectic therapy. So eclectic, if you're familiar with that word, it means like borrowing, it's like varied from multiple groups. So we're going to go over different perspectives of psychotherapy, and eclectic kind of borrows from the perspective that suits that particular client. So this is very common in this day and age for therapists to be more eclectic minded in their treatment plans, because someone might come in with something and they might need more behavioral help, or they might need more help cognitively. So it depends on the client with eclectic. So our first perspective is psychoanalysis. So remember, this is Freud's perspective. So it's always about uncovering the unconscious through various ways. And the goal is to gain self-insight, is to become aware of what was once unconscious. So there's a variety of techniques that he used, free association being one, where the person just kind of discusses stream of thoughts, just kind of pouring out. Another one is dreams, dream interpretation, to find that underlying meaning of the dream, also known as the latent content, the underlying meaning. And he would also look for resistance. So resistance would be any sort of pushback or blocking from consciousness, anything that brought anxious feelings. He would also use interpretation, where he would really note the latent content of the dream, or he would note resistances or any other things like that that would kind of make the client more aware of what they're doing to help them get closer to this unconscious. And he would also look for transference, and this is when the patient transfers how they feel emotionally about a particular person, relationship with someone else. Maybe they hate their father, and so they start transferring those feelings of hatred towards their therapist. So that's called transference. So psychodynamic theory, remember those were the neo-Freudians, and so they're still looking at that unconscious, but they're not so focused on the id, ego, and superego. And they're also more focused on the client's current they're focused more on the client's current symptoms, meaning they're looking to relieve those symptoms more quickly than psychoanalysis, which is definitely a benefit of psychodynamic therapy, is that it can work much quicker. Insight therapies. So psychodynamic and humanistic therapy, which we'll talk about in a second, are both under the umbrella of insight therapy. And the goal of this is to improve how someone feels and what their functioning ability by increasing their awareness of any underlying motives and defenses that they have. So they have a different take on it. Humanistics don't focus on the unconscious the way psychodynamics do, but the goal is still the same, is to connect the person to their selves so that they can become more aware. So the humanistic perspective is unique from psychodynamic because it really focuses on self-fulfillment. Remember Maslow's hierarchy of needs? It's trying to help them grow in self-awareness and in self-acceptance. Carl Rogers is our other humanist who talks about acceptance and unconditional positive regard. So promoting growth is the focus here. It's not about curing an illness because their idea is that problems really come from this inability to grow. And so if this is fostered, then the person will feel well, and not just well, they will thrive. So conscious thoughts here are more important than unconscious, and the present and future are much more important than the past. So client-centered therapy is a type of humanistic therapy developed by Carl Rogers, and that's where he works on creating that genuine, accepting, and empathic environment to facilitate the client's growth. How he does this, he uses active listening. So this is really empathic listening in which the listener echoes or summarizes, clarifies, restates their whole body language. Everything is telling the person, I am holding on to every single word that you say. You have my full attention in all the ways. Nonverbal is probably more important even than verbal. Unconditional positive regard is another way where he shows a caring, accepting, and non-judgmental attitude regardless of what the person says. And so here are just some ideas of how you can more actively listen. These are great skills to take into any relationship that you have with someone. People will feel more accepted by you, more welcomed, and more willing to talk to you when you do these things that Carl Rogers discussed. So behavioral therapies, those are going to focus on the actual behavior as the problem. They really think and doubt the idea that self-awareness is really going to do anything. Like you can become aware that you're anxious during a test, but the next test you're still anxious. So behavior therapy is really focused on solving that behavior problem, not driving deep below the surface. So one type of behavioral therapy is counter conditioning, where you use classical conditioning to create a new response to a stimuli that triggered some unwanted behavior or reaction, such as fear. So two types are exposure therapy and aversive conditioning. So you would pair the triggering stimulus with the new response. So for example, here, there's a dog, he's afraid of other dogs. So pairing the dog, the other dog, with something the dog likes, which is a treat or a bone, and after repeated exposures of those two paired together, now the dog is no longer afraid. It doesn't evoke that fear or aggression or stress response in the dog. The dog's happy because it has that association of how it felt with the treat or the bone. So exposure therapy is under this umbrella of conditioning, and it would maybe use systematic desensitization or virtual reality exposure, and it treats mostly anxiety by exposing people to the thing that they fear and avoid. So getting them to slowly not avoid that. So systematic desensitization is exactly how it sounds. You want to start off by learning, they'll teach you relaxation techniques so that you can use those when you are in that moment of seeing or experiencing the thing that causes you upset. And then they might start off first with just visualization. If it's flying, you start just first by visualizing it. And you kind of get closer and closer gradually. It has to be gradual. As soon as the person really seems really anxious, they want to go back to the relaxation techniques and out of imagining that or out of the situation. And until they are able to fully do the experience without any anxiety. Virtual reality exposure works the same way, except you actually, have virtual reality headgear, you are experiencing it in some way virtually, and it could be anything. So this helps people who maybe are afraid of flying, and it would be really hard to practice in other ways, but virtual reality makes that possible. If they have a fear of going in the subway, they can virtually go in the subway, but also rationally know that they are safe in their therapist's office. So aversive conditioning is, again, a type of counter conditioning that associates an unpleasant state, something they won't like feeling nauseous, with an unwanted behavior. So if someone wants to stop drinking, pairing that with the feeling of nausea, like putting a drug in the alcohol that makes a person feel nauseous, could make them averse, meaning wanting to avoid drinking alcohol. And that's the goal. The only problem with this is that the person might realize that, oh, I was in a treatment program where they did that, but now I'm out and I'm at a bar and it won't taste bad. It won't make me nauseous. So there's, it's best if it's used with other forms of therapy and not just alone, because we do have brains and we will figure out that it won't always make us nauseous. So operant conditioning is another behavioral therapy where behavior modifications are used. So positive reinforcement is the key here. There's many studies to show that this can be really helpful in children with autism. They've used it on people with schizophrenia in facilities to help them interact more rationally. They've used it with people, with children with intellectual disabilities to help them do things that are important for life functioning or daily functioning. And so what's often used is called a token economy, kind of like this board over here, where the person would earn a sticker or some sort of, it could be like a token in a jar, and if they collect a certain amount of tokens, whether that be stickers or whatever, then they get whatever they're working towards, some sort of reinforcer. So going to the movies, getting a new toy, whatever that thing is, getting to do something fun at school. So they're always working towards that. That's a token economy. All right, and then there are cognitive therapies. And the cognitive therapies teach people new, more adaptive ways of thinking. And it's based on the assumption that thoughts really intervene between events and our emotional reactions, and this is therefore an important component to help people adjust so that they feel better. The focus is challenging their self-defeating thinking. So for example, someone with depression who loses their job might think, I'm worthless, this is hopeless, I'm never going to get a job again. And they're going to use really strong words and they're going to ruminate on it. They're going to go over and over how this was their fault and how terrible this is. And that's really going to lead them to a dark place with their thoughts. So you might want to pause this here. I suggest that to kind of go over the different cognitive therapy techniques. But basically the goal here is to reveal the beliefs, test the beliefs, meaning let's really question some of these things that you are saying. I'm never going to get a job. Let's test this. Where can we look at this before? Have you not had a job before? Have you gotten a job before? Things like that. And then the goal is to get them to change their beliefs. So another form of cognitive therapy is REBT, which is Rational Emotive Behavioral Therapy. So Albert Ellis developed this, and it is confrontational cognitive therapy, which sounds strange, but he basically stops them in their irrational thought and kind of drives home the message that that's illogical, and don't you know that's illogical? And they really do know that's illogical, and it kind of like forces them to acknowledge that irrational fault that they have, I'm never going to get a job or whatever it is incorrect, so that they can find a new, more adaptive way of thinking and stop the self-defeating attitude. Cognitive behavioral therapy is kind of a combination of the two, cognitive therapy and behavioral. So the goal is to get the individual to be more aware of that irrational negative self-talk. So that sounds like cognitive therapy, right? And it's to practice a more positive approach. And so that's the behavioral component. Usually behaviors are kind of started to be worked on first in this type of treatment, because with those new behaviors can come some more useful thoughts kind of naturally. It's very effective for anxiety, depression, OCD, and anorexia nervosa. And so the person has this thought, and those thoughts can lead to certain feelings. Those feelings can lead to certain behaviors. And it's all a cycle that the person is stuck in that CBT helps to kind of dissect and stop. Group therapy is conducted with groups, and there's a lot of benefits here. First of all, it can be saving them money. It can be less time for the therapist, meaning they have more time to see more people. And it might be just as effective, according to research. It's also offering this dynamic where you have other people that you can kind of say whatever your thoughts might be and bounce it off of people in a safe place. And so people find that useful. You can also see that you're not alone and that others share the same problems and feelings and insecurities as you do. And they can try out new ways of behaving. Family therapy, it works on looking at the family system and what is perhaps not working. A lot of times they look at boundaries and setting healthy boundaries amongst family members so that everyone is kind of getting what they need and can be happy, especially if they're living in the same environment. Self-help groups, these are really useful to people, especially people who have felt stigmatized, or maybe they have an illness that is, they feel it's embarrassing or it's hard to discuss. Again, probably because of stigma around it. For example, AIDS patients are 250 times more likely to seek group support than patients with hypertension. It's much easier to talk about hypertension and you don't feel like I'm the only one. Whereas someone with AIDS, AIDS is very stigmatized and you might not know someone else with AIDS. So going to a self-help group can be much more rewarding. And there's also programs like AA, which I'm sure you're aware of, who have shown to be very helpful to people. And those would also be self-help groups. So here's a great chart. I would pause this and kind of look it over. It's everything we've just discussed. The goal, the therapy aim, and the techniques that they used. So great chart. So remember, psychotherapy is that umbrella term for all therapies, and eclectic is a modern way of taking from each perspective depending on what a client needs. Insight therapies, that means psychodynamic and humanistic. But those two therapies, they really focus on self-awareness. And so becoming self-aware is that insight, that aha moment. Behavioral focuses only on the behavioral problem, pretty straightforward. Cognitive focuses on the maladaptive thoughts and irrational thoughts. And groups can be especially good for those that feel stigma, as well as self-help groups. So that sums up modules 70 and 71, and I will see you